just and peaceful societies to our children and grandchildren. To achieve this, we focus on identifying, developing, highlighting, and spreading effective future just solutions for current challenges facing humanity and promote its implementation worldwide. We work in close collaboration with international organizations, experts, and parliamentary networks. So we also are the organizers of the only policy award scheme in the development sector, known as the Future Policy Award. This award celebrates policies that create better living conditions for current and future generations. Every year, the World Future Council identifies one topic on which policy progress is particularly urgent. The aim of the award is to raise global awareness for exemplary policies and speed up action. In 2015, Zanzibar won the gold medal for their child protection law and the successful implementation of their one-stop center child protection program. And today we find ourselves exactly 1 year that the WHO declared COVID-19 as a global pandemic. Since then, there has been numerous reports of increases in sexual and physical violence against children across the world, Africa not an exception. UNICEF reports that the situation is alarming and calls for urgent steps to prevent the years of progressive work around preventing violence against children going down the drain. So in the next 1.5 hours, we are going to be discussing how we can all help in preventing violence against children and also sustaining some of the progresses we have made so far. In this 1.5 hours, maybe to 2 hours, you will be hearing from Dr. Nkata Murungi. Dr. Murungi is a counselor at the World Future Council. She is an assistant director of the Center for Human Rights and a senior lecturer at the Faculty of Law of the University of Pretoria, South Africa. She will be giving us a broad overview of the situation of violence against girls, boys, and young women in Africa and how COVID-19 has influenced the situation. We will then get an overview of the situation in Ghana from a rapid assessment survey done by Ms. Bashira Kamal, a gender and labor specialist from Ghana. Ms. Halima Salum, a former Deputy Principal Secretary of Health in Zanzibar, and Ms. Nkasa Abdallah, a Principal Child Protection Officer at the Ministry of Health, Zanzibar, will tell us about the Zanzibar Children's Act and explain the positive impact of the one-stop center child protection model in the country. Professor Ebenezer Badu, a pediatric neurologist and child protection specialist at the Kolebu Teaching Hospital in Ghana, will also be joining us to share with us the overview of violence against children cases reported at Kolebu, the premier health facility of Ghana, and how such cases are handled and the support systems in place for survivors. Finally, we will be hearing from Ms. Abena Apreku Bedu Abuaji, a Principal Program Officer, Child Protection at the Ministry of Gender, Children, and Social Protection of Ghana. She will be also giving us an overview of the child protection systems in Ghana. She will tell us how the ministry is dealing with the increasing number of abuse cases and what plans are there to improve the situation. We will then open up for questions and answers from you, our audience, our our participants, questions that will be responded by our panelists here. Please write your questions as we move on in the chat, in the comment section. Thank you very much. So I would like to welcome you all, our participants. Thank you for joining us. And also, I'd like to welcome our distinguished panelists. Thank you for accepting our invitation and making time to speak to us today. So we are, as we are here on Zoom, we are also live on Facebook. You can invite your friends, you can share. If you're joining us on Facebook, please share with your friends and invite others to also tune in and get some of this interesting information that we are about to share. So going into our first speaker, we will be speaking to Dr. Nkata. Hello, Dr. Nkata. Thank you for joining us.
Thank you, Ramana.
So, Dr. Murungi, what is the current situation of violence against girls and boys and young women in Africa? Is it that bad?
Okay, thank you. Good morning, good afternoon, those who are in a different region, and probably even good evening to some of us who are joining from other regions. It's a pleasure for me to join this conversation and to be able to share, even if briefly, some of the aspects affecting children and specifically violence against children, with a focus on Africa, mostly because this is where I'm based. So yes, to respond to your question, I think this is a very timely conversation because yes, violence is not, it's never a good thing, even if it were less. But the reality is that actually we do have a lot of violence against children, if you can put it in those terms, in the sense of magnitude. So maybe because this is I am the first person to speak on it, I would start by saying that the basis of which we are talking about violence against children is that it is, as in international treaties and regional treaties, we understand violence from many perspectives. Violence manifests in physical form, in emotional and psychological form. It could be sexual, it could be occurring in different forms. And so when we talk about violence against children, we are talking about all these dimensions and how it's variously manifested. So it's difficult to say one country to another in the sense of maybe this country has more violence against children than another, because you find that some forms of violence would be prevalent in one country and another form probably more prevalent in another country. So from that perspective, it's not very easy to compare. But what we know, particularly in the African region, is that violence is in every country. Violence against children is endemic in social practices across the region, and it manifests in various forms, which I will get to quickly. But maybe before even we get into that, it's just to indicate that violence against children is not peculiar to Africa. It's a global phenomenon. And as you may have seen, if you read the 2013 global study on violence against children, you realize that it is really a worldwide problem, which has some specific African manifestations because of the context in which we live in, but which is a global issue. That is why the UN has a dedicated special representative on violence against children. So within the African region, there has been some studies that are done to document the extent of violence against children. One of those studies is done, for instance, by the African Child Policy Forum. It's documented the extent of violence against children, looking at some of the specific countries and how far they are in terms of managing violence, which shows huge disparities from country to country in terms of the response measures. But in the sense of what is out there, physical violence is very prevalent. Physical violence, most of it which is couched in the sense of disciplining children, and which then results in injury and harm to children. It ranges from corporal punishment in the home, corporal punishment in schools, as well as corporal punishment by law enforcement authorities. That is it's a huge problem on the African continent. The second sense of physical violence has to do with violence in the public space. You find that certain groups of children experience violence routinely, especially children living on the streets. And this kind of violence is tolerated by society. Again, this was almost in every country. In some of the countries that were surveyed, children up to over 70% of children reported experiencing corporal punishment or physical punishment of some kind or the other. Sexual violence is also very high across the region in various forms, and also from a point of view of differences within gender, with girls experiencing more sexual violence. It's reported that a lot of sexual violence in the African region happens in school settings, which is very upsetting to imagine that spaces where children spend a lot of time is where they could also be violated. But sexual violence is something that is very common. And again, a huge number of children who were interviewed were speaking about having experienced some form or the other of sexual violation in the course of their lives. Sexual violence is also very hard to prosecute in some countries because of how it is presented in the law. So some of the things, the conducts that the children felt was violation to them were not captured in the law. So there is a gap between how children experience sexual violence and how the law responds to sexual violence. There is also violence that is mental or psychological, which was a lot of it. So children report being abused, being insulted, being threatened, but this is not captured in any law actually, but it's very prevalent across the continent. It's almost a part of child upbringing. The children generally get, told things that are harmful to them, but there is no way of finding justice or accessing justice for such treatment. Then, of course, the African region also has a very rich culture and cultural practices. And we find that in regions, across the region, we have huge disparities of how cultural practices are performed. But some of them, majority of them, in fact, are very harmful to children. So there's harm that comes from cultural practices such as female genital mutilation, markings, and other rituals that are done to children, such as breast ironing. They are very painful experiences for children, couched in the sense of culture. So that is also something that is documented very widely on the African region. And I think the last form is in the sense of neglect, children just generally being left out on their own, and therefore suffering because nobody is really responding to them. If you put all these factors together, some groups experience violence more than others. Girls experience violence disproportionately more, some kinds of violence. And girls in particular circumstances, besides sexual violence, it's especially girls who are domestic workers, which is a phenomenon across the region, where we have very young girls working as domestic workers, which is child labor. But besides that, it's really a form of violence against children that needs attention. And children in conflict, sorry, I'll just finish. We also have a prevalence of conflict on the continent. And I don't just mean international conflict, I also mean conflict within countries, including recent phenomena that has to do with children associated with terrorism or terrorist groups and activities. And really children are experiencing extreme forms of violence as a result of either being associated or being affected by conduct like that. So this is just a very brief and general picture. I cannot even exhaust the other manifestations. Yeah.
For lack of time, there were so many issues we can go so deep in, but for lack of time, we will have another session someday that we go deep into how to manage some of these things from even the society point of view, from individual point of view. But just a quick one. All these things you have touched on, all these issues of violence, has really covered worsened the situation, or has it always been like this?
Okay, so I think I think it's both. I think that in one way, COVID has forced people to face the realities of what is wrong in society. And one of the things that is wrong in society is the situation of violence. So it's not that it wasn't there, but now it's really so much apparent that we cannot ignore it anymore. That's one dimension. However, COVID has also brought another reality, which is that children as well as adults are confined in spaces. And so one of the main effects for children is that most of the safe spaces for children where they would report or interact with authorities that could intervene on their behalf have been closed away because of COVID. Those are places like playgrounds, those are places like schools, especially schools. So the closure of schools, one of the side effects of the closure of schools is that children now don't have a second party to go to if they're experiencing violence, and therefore the interface between children and law enforcement has been curtailed. Secondly, the limitations of movement just simply means that a child is not able to get away from their abuser. The evidence that we have shows that majority of child violence actually happens within the scope of their family and safe, the closest people to them. So if they are then forced to live with those people without the opportunity to be able to get out and maybe find out or meet someone else that they could speak to, obviously it increases their exposure to violence. Within the African region, one of the first things that happened when COVID came is that governments took very drastic measures very quickly to respond. Nobody consulted children. So there was no participation. There was nobody who tried to find out how would this affect children. The first thinking was, how do we quickly get out of this pandemic? And that has left a huge gap because the measures were not child friendly. They quickly closed, for instance, child institutions. So even children who usually would have found some kind of refuge no longer have places to be referred, even if they were in situations of danger and violence. So yes, I think the answer is two-way, that COVID has increased the risk for children and exposure. It has also created new avenues for exposure because children are now much more exposed to the internet, and so cyber-based violence and cyber-based exploitation is happening more. But secondly, it has shed a spotlight on an existing problem of insufficient measures to respond to violence against children, or even when it happens outside of the context of the pandemic.
Thank you so much, Dr. Moringi. You have really, really shed light on this and simply clarified it for us. What's really struck me with relation to the COVID situation is that the fact that the measures were not child friendly because children were not even consulted. And yeah, and we are seeing all this as a result of that. And we have one of our speakers who did a quick or rapid assessment survey of the situation in the very first phase of the pandemic. She is the person of Miss Bashiratu Kamal. Ms. Bashiratu Kamal is a gender and labor specialist, and she undertook this rapid assessment last year in the heat of the COVID to find out how that is affecting boys and girls. So, Ms. Kamal, can you please share with us the results of your assessment in Ghana?
Hello, Ramana. Thank you. And it's good morning in Ghana and good afternoon and evening to everyone from other parts of the world. So Doctor has done a good job in giving the introduction about whole situation and also explaining gender-based violence against children and the situation. So I'll quickly delve into the details of what actually happened when I undertook the rapid assessment. So we all know that according to the United Nations Women, during any pandemic at all, women and girls may always be at higher risk of experiencing intimate partner violence and other forms of domestic violence due to heightened tensions in the household. And we all know what this COVID presented to all of us. There's an increase in gender inequalities and the vulnerabilities of already vulnerable groups of people, and a higher risk of abuse against women and girls. In Ghana, prior to the pandemic, the education of girls was already at risk of child marriages, challenges relation to access due to several factors, including poverty, superstitious beliefs that include when a woman menstruates, she's not able to cross a certain river, so she has to stay back home. And also the lack of sanitary pads and the risk of teenage pregnancy. And this, according to the deputy minister, was standing around 14.2%. And in Ghana, during the time of the pandemic, part of the responsive mechanism government put in place included the closures of schools, which even lockdown, which meant that online learning platforms, which is via television, and for some schools, they were using internet platforms. What were the impacts on children during the time of the pandemic? Before COVID, World Health Organization had reported that adolescent pregnancies were a global problem. And during the pandemic, Ghana recorded alarming rates of teenage pregnancy in some areas due to the closures of schools and due to the working arrangement of some parents. Unfortunately, we are talking about teenage pregnancy, but nobody is putting focus on how the children got pregnant, because the laws in Ghana says that it's only a child, someone around the age of 16 who can give consent to sex. And you have children in junior high schools, 15 years and below, who are getting pregnant. It means there's a case of defilement, there are cases of rape, there are cases of incest, but we are focusing more on the issue around there are more children who are pregnant. So part of the data I was able to gather included, and this was during the period of the lockdown in 2020, in one of the regions, Volta region, according to GES, from March to September in 2020, they recorded about 676 pregnancies. In another region, according to the World Vision International, from March to May, that is in the Karachi West in the Oti region, they recorded 51 pregnancies. And then in the Central region, they recorded, that is from January to May, they recorded 3,198. It is true that some of these areas already had a higher rate of teenage pregnancies. But if you look at the data, what we've always been getting were data from January to December. But these ones are in the first quarter or within the second quarter. And I've already mentioned the how, that there are issues around sexual exploitation, issues around rape, issues around defilement, but we are focusing our attention so much on the fact that the girls are just pregnant and not looking at the root causes. Who is defiling the girls? How did it happen? Are we supposed to get somebody punished? Are we supposed to get somebody to court? We are not discussing that. And girls consistently and continuously go through all these forms of abuses every single day, even after the partial lockdown was lifted and after some of the restrictions have been eased. And what is accounting for the issues of poverty? Because of economic devastation, parents have lost jobs, people have suffered pay cuts, people have no wage challenge and capital losses. Because of that, parents are not able to provide for some of the children. In one of the reports by one of our media houses, My Joy FM, My Joy Online, one of the children said that they didn't have enough at home and she was forced to go out to have sex with somebody, so that she can have 10 cedis, just 10 Ghana cedis, something that is less than $2, so that she would take it home to support her family. And that impact was also in a way supported by the parents, which also is a sexual exploitation, So parents are also in a nice way sexually exploiting the children, which are an offense under the Criminal Offences Amendment Act in Ghana. And then we have the issue of unemployment. So in a Jumakuenya district, for instance, there were job losses and there were no jobs already in those areas. So then it became a very big issue. One of the girls said that she needed money to buy a sanitary pad, which was 5 cedis. So that is what accounted for how she was defiled. The new work arrangement, the shift system that was introduced at some point for parents when the partial lockdown was lifted, that parents needed to be at work at a certain time and the children were at home, left in the care of unscrupulous people and then also in the care of predators. And we know what the closure of schools caused. The closure of schools actually heightened the challenges because according to Marie Stopes, all of them needed to close their offices. And in countries like South Africa, Zimbabwe, and some other parts of Africa, the government, after instituting the partial lockdown, made service providers to sexual and reproductive health rights an essential service. So they could still work around that period. Those who were providing support for victims of sexual abuse and institutions like Marie Stopes. We didn't have that in Ghana. So it meant that some of the protection and where children could get solace were all closed. And there was also a lack of access to sexual and reproductive health services for children. And then in Ghana, we already have an issue of sex education where people do not even want to discuss it at all. And we had a challenge when government was trying to introduce a comprehensive sexuality education, where we just trashed everything and we allowed the government to pick everything back. And the issue about the culture of silence, which is also killing us, that children are not even able to report cases of abuse when it happened to them for fear of being victim shamed. That what were you wearing? How did it happen? What did you go to do there? You know, nobody is asking the question and taking the perpetrator on.
Yeah.
Also, there's an issue of the school feeding program that has been introduced in Ghana. So for the school feeding program, when school is in session, children know that at least for nothing at all, they can get a meal a day in school, which they do not have to suffer for because the government is providing. But in the time of the lockdown and when school was closed, there's nothing like that. So you are wholly dependent on your family. So some of the impact includes the chain of poverty, and children have resumed school now. We are having cases of some of the girls not going to school and the lack of childcare facilities. So if you have a girl who is still interested in going back and has a baby, there's no space or facility that can accommodate her. Also, apart from that, there is the issue of a pregnant lady, a pregnant girl who sits in the classroom and the desk is not good enough for her because the desk is so small that she cannot fit in. Then we know of the psychological and the emotional traumas and the child marriages. Plan reported that in the period of the closure of schools and the the partial lockdown, parents up north were giving their children in marriages so that the spouses and those they are betrothed to can support the family financially or with some sort of basic needs so that they can survive during the period. And we should also know that when these happen, most of these children are going to end up in abusive marriages because they did not in the first place have saved. So going forward, government needs to consistently put measures in place, and we need to punish perpetrators to serve as a deterrent to others. Yes, it is very painful when it happens that young girls are pregnant, but beyond that, what are we doing to the perpetrators? Who are getting the girls pregnant should be paramount when we are discussing these issues. And we should continue the sensitization program. Ghana Education Service has instituted a policy guideline, re-entry policy guideline for girls. Unfortunately, some of the teachers are not working to support this re-entry policy, and we have some head teachers and headmasters who are who are not supporting it because to them, the children who are pregnant, they are putting every blame on them and saying that they have disgraced the school and they are bad influence on other children in the school. And we need to encourage the inclusion of sexuality education and sex education in our curriculum. Well, in conclusion, I'll say that all forms of abuse against children are extremely harmful and causes physiological and emotional traumas for the victims. And the economic devastation is still hitting hard because we are still in the period of the pandemic. Are we going to have more if children are left to fend for themselves? And it is possible also that our country might face another pandemic if we recorded this within that short time. What is going to happen in 2021? And we have a discrepancy between marriage age and the age of consent. So parents and other perpetrators have a leeway. If we want to continue to commit towards the SDG 4 on education of girls, we need to put in place towards an Agenda 2063, which focuses on building our human capital as Africa, which is our most precious resource now as we speak. And we can only do this through the elimination of gender disparities at all levels, education, in our homes, and everywhere that we find ourselves. Thank you. So briefly, this is what I will say. Thank you, Ramana.
Thank you so much, Bashira, too. Thank you so much. You've really touched on so many of the issues that we know that there is a huge problem out there from different facets, from issues bordering on even the upbringing of children, the parts that parents play in the government institutions, what we're doing to help prevent some of these issues, exploitation, sexual exploitation of children, even by parents, which is so disheartening that parents can push their children to go and be exploited sexually so that they can have money. And girls, just to even get 10 cedis, which is not even up to a euro or so, to buy pad. Because of that, they are being raped. All these issues need to be addressed. And for me, narrowing it down to the pandemic, narrowing it down to what we are discussing in this context, I think the closure of protection centers and also even the unavailability of protection centers. When children can really stand up for themselves and say, I don't want to go through this, where do they go to? Who do they report to? If they are being exploited by the parents, who do they go to? Do we have adequate resources, adequate institutions that a child can just go to and say, look, I am being exploited, I don't want to be exploited. How can I get help? So that brings us to the point where we highlight one of the solutions that has really worked well, effectively in Tanzania, which is the establishment of their Children's Act in Zanzibar, the establishment of their Children's Act, which one of our speaker, Ms. Halima Salun, who is a former principal secretary of health in Zanzibar, who spearheaded this act. Ms. Halima, can you tell us what is so unique about the Zanzibar Children's Act? Yes, we can hear you now.
Okay. Thank you, Ramada. Zanzibar as other parts of the world, the violence against women and children is a challenge facing the community. And different types of abuses are happening within communities, including physical, sexual, emotional, and neglect. But in many years, the incidents were not well reported, as the mechanisms for reporting were not well coordinated. And also, because of that, there was also a lot of stigma. So people were afraid to come to report the various cases. And the most affected population, as we know, are mostly women and children, and mostly boys and girls. Different interventions have been initiated, including establishment of one-stop centers, child protection units, children courts, gender and children death, and development of the Child Act Elimination. Earlier, children issues had been scattered in different laws and in different stakeholders. Everyone was working in an isolated manner. So, and the services were not provided in an coordinated way. So after the development of Children Acts has strengthened the child protection system. And to answer your question, the most unique thing in this development of one-stop center that we have brought together all the professionals together, and also we have reduced the burden of the children, of the victims and the abuse victims to go in different institutions to get the support or get the help for getting the services. Like first they have to go to the police station, report the cases, and then the police will tell them you have to go to the hospital and then get checked up, and then we have to get the evidence if they have really been abused and so forth. And then also they have to get some counseling, and then the cases has to go to the court. But so we have seen that the victims and also the professionals spend a lot of time, and it takes a lot of time for the victims to get their rights and also to get this service, to get the services, to be treated and so forth. So we started, we had a visit in Zambia. We went to Zambia and then we saw the model, their model. They started this model of putting all the professionals together. So we said, why not Zanzibar? We can replicate this good practice. And indeed, we have replicated it since 2010. We have started with 2 workshop centers. First, we started in Unguja and Pemba. We started with the main hospital, that is the National Hospital, and also in Pemba at the Chaki Hospital, which is the main hospital also there. Because Zanzibar is divided into 2, it's an island, but it's divided into 2 islands, Unguja and Pemba. So we started as a pilot in these two hospitals. And we have seen that it has brought a lot of success. It has brought a lot of success. Many people here used to say, why don't you start in our district? So we said that it's better to scatter these centers in different districts. And now we have seven workshop centers. And it has really reduced the burden for the victims to travel in different areas, to use their transport and money to go in different areas to get their services. So this is just an introduction. I'll let Nkasi continue with the children acts, the explanation of it.
Okay, so Ms. Nkasi, you have been working on the one-stop center, on the implementation of the one-stop center. So can you give us a detail of how does it work? How does this whole one-stop center thing work?
Thank you, Ramana. As Madam Halima has mentioned, the Children's Act has strengthened the response to child abuse cases, and one-stop center is serving all types of cases, in fact, physical abuse and sexual abuse. And so, as she has also mentioned, that it has put closer the different professionals. So the center is composed of certain professionals who are working. In some of our centers, we have been successful to work within 24 hours, but not in all centers that we have. As she has mentioned, we have 7 centers right now, but one, which is in the referral hospital, is working in 24 hours. We have been successful to start with that. And so the center is working from the reporting. So for example, whenever an incident has happened, the report is being sent to police, and sometimes the victims are directly sent to one-stop center. So when they reach the one-stop center, the first contact person is the focal person. So we have a social worker who is a focal person, and she's the one, or he's the one who is receiving the case. They're making an interview with the victim and the guardian who has come with the victim, or it depends on how it was reported and the report came from who has reported the case. So after the focal person has interviewed the victim, so she is facilitating the service. And so she's connecting the victim to police so that she can get we can fill the PF3, we call it police form number 3. Mm-hmm. And after filling the form, the victim is sent for medical intervention. So for medical checkup, and then after the medical report, She's been sent back to focal person for further interview and for counseling and other services. So one-stop center is serving main three services: police, the focal person, a social worker, and also medical intervention. And after that, so the case is being sent to the other police station within the area where the victim is coming from for further investigation. And then other support, for example, whenever one-stop center is receiving the case, so they are referring the victims to social welfare officers at district level for further intervention and for further case management. So that means we're working together, social welfare officers at district level with the one-stop center at district where the center is situated. So this is how it is working. And so as I have mentioned, now we have been successful to work with 24 hours. And in some centers, it has been working only 8 hours, but now we have also expanded to 12 hours. So working on all centers to be working at 24 hours because we never know at what time an incident can happen. And so we are struggling to work to see that the one-stop centers are working well and also are providing services whenever it is needed by the victim and the survivors.
Great, great, great. So just as a clarification for our audience, the one-stop center, Zanzibar won the Future Policy Award for 2015 for this their model Children's Act, and one of the programs under their Children's Act for protecting children was the establishment of the one-stop center. So in effect, the one-stop center comprises a center normally will be situated in a hospital where people can get easy access. And there, when a victim reports there, you are you are assured of secured, comfortable, and confidential environment where the case has been taken, reported. There is the presence of a social welfare person who would immediately offer psychosocial support, emergency help to the victim. A police person in a normal attire will be there to guide and provide medical exams form, gathers information, prepares all the documents for arrest and prosecution. The medical team is also there who does the medical examination and gathers evidence. And then there is ideally also a legal person who is stationed there also to gather and secure evidence for the needed prosecution. So this is what Zanzibar has been able to implement. And as Ms. Halima and Ms. Inkasa has said, they are now running these centers, not just in one hospital, but in so many hospitals and giving 24-hour support. So Ms. Inkasa, during this pandemic, during this COVID situation, are the centers still running?
Yes, the centers were still running.
Okay.
Maybe I can help out with that. The center did not stop running during the COVID-19 epidemic. The centers continued, but there were challenges that people were scared to come out, so to come and get services. So the number of the cases have been reduced, not only because the cases have been not because the cases have reduced, but people they were not willing to go because they were scared of getting contaminated, maybe in the hospital and so the cases were there, the hospitals were working, but we were getting only very few people who come and report there. So it was a little bit of a challenge.
Okay, because people were scared of coming to get infected with COVID, but not because they were scared of coming to report abuse cases, right?
But that it was only for 1 or 2 months in the beginning, like last year when the COVID was really taking a very high, it was at a very high speed. But later, after 1 or 2 months, the people are coming to normally.
Okay. Thank you very much for giving us this insightful information about the One Stop Center and the Children's Act of Zanzibar. And we will now be speaking to Professor Badu. Professor Badu has been working at the Kolebu Teaching Hospital. He is also a pediatric neurologist and also a child protection specialist. He's confronted with cases of abuse daily in his line of duty. So we want Prof to tell us, Prof, if you're there, can you please explain to us or share to us how serious the situation is that you're confronted with every day?
Hello.
Hello, Professor.
Thank you very much. Can you hear me?
Yeah, we can hear
Yes, can you hear me?
Yes.
I'm having.
Yes, we can hear you.
Yes, I'm having challenges with my all right, I'm from Ghana with service in a hospital in Ghana, and this was way back as far as December 2009. And obviously, this followed a spate of quite serious cases that had presented to the hospital the year or two before. So we christened the unit Le Bateleur, which is named after an eagle that lives in the Shai Hills of Ghana. And it's all obviously a bird found in the wild, but it's very protective of its young. So that is the name given to the unit, Le Bateleur Child Protection Unit. We have seen a steady stream of cases. We probably would average 40 to 50 cases per year. But that may sound like a low number to you, but then we are talking about very serious cases that would come to a teaching hospital. Because we work in a teaching hospital, I mean, obviously the daily cases of abuse going on in the whole community will probably not end up in a referral center. So the cases that usually would be referred to the teaching hospital will be serious. So even if we see one, even if it is one in a month, and it's very serious, it's of great concern because there's a likelihood of severe disability or mortality actually from surgery and can be very harrowing. That's what we call is a differential of bleeding. And I think I'm raising it here for people to become aware that it's not every time that a girl who comes bleeding would definitely have been sexually abused. Urethral prolapse is uncommon in the Western populations, but I think in our populations, it is not that uncommon. So every now and then, a case like that will pop up. So that's the main thing in terms of differentials and what we see. Overwhelmingly, it is child sexual abuse, and injury is also another category which concerns me in terms of what we see. In a teaching hospital, we would see the usual case after having referred from the community or outpatients department. So a registrar will see together with the child protection specialist, nurse Harriet, who is listening in. And then depending on the outcome, referrals are made. We then contact whether it's clinical psychology, social services, or laboratory services for our patients, and then we see them through. When you talk about support systems, I don't think our support systems are very good because more or less this is like a beginning for us. So the support system involves obviously multidisciplinary working, which hasn't unfortunately been uh, put in place. Put it 100% kind of frame. So when you talk about support systems for survivors, I think that's a big challenge for us. What happens after we see, we don't even know because in our setting, a lot of people prefer to settle cases. I'm sure you've heard of that. I mean, people don't like the stigma of going to court and being shamed. So people pay, and then the case is off. And then very few cases, very few prosecution in Ghana because of this cultural thing. Usually these are elderly people who are known to them, and it's disgraceful to take them to court. So they settle, and then we don't know the outcome. But a positive thing is that we are unique in the sense that we have an opportunity to train younger doctors. And that is the good thing that we've started to do. We put child protection or abuse on our formal lectures for medical students. So for the first time, I mean, for the past few years, it has gone down very well. Our students receive formal lectures in child protection work. And I must say the spin-off has been very good because ever since we started teaching them formally, our doctors are now picking up abuse cases, even on the wards. So that needs to be spread across the country, across the medical curricula and in nursing curricula. Child protection needs to be taught formally. And we are in a position to do that because we have the experience and we want to teach and expand that. So basically, that is what my experience is from the child service at Kolebu Teaching Hospital in Ghana.
Thank you so much for sharing your experience with us. Quickly, what is your view on the one-stop center model? Do you think this is something that would really help the country?
I think it will be a fantastic thing for us because you have the major advantage that this is the biggest referral hospital in the country. And secondly, because it's a training institution, you have all health professionals coming through. So this is where they are going to learn all their models of working. Even the idea of multidisciplinary working is a crucial thing in any hospital. That model of working it's not common, and this I think gives us a unique opportunity to. So it's long overdue. It will be a good training ground for all doctors, nurses who are training through this big hospital, and then we know that other places will spring up in the country.
Sorry that we are having technical challenges with Professor Badu.
We train well in a place like that. And knowing that model of working, we hope that it will cross the country. Hello? Yes. So I think the more for us, it needs to happen because we need to strengthen the way we teach this whole subject of child protection.
Okay. Thank you very much, Professor Badu. Yeah, as you mentioned, 40 to 50 cases a year coming to a teaching hospital, which is like the final referral destination. It means that if the teaching hospital is recording 40 to 50, I can imagine how much the district, the small hospitals, the community hospitals are recording. So there is a huge number out there that needs to be looked at. And thank you for your interest, your support in the ongoing processes and discussions to establish the one-stop centers in Ghana. And thank you for giving us a space, already allocating a space that could be used for this. And we hope that we can all continue to work together to make sure that this is done in Ghana. So speaking about establishing this in Ghana, we will be speaking in a short while with Ms. Abena Apreku, who works with the Ministry of Gender, Children and Social Protection of Ghana. Ms. Apreku, as you heard Ms. Bashira to tell us about her rapid assessment of the situation, you heard Professor Badu tell us about the situation at Kolebu, you heard Ms. Halima and Ms. Nkasi also share their model and how successfully it's working. When it comes to Ghana, as the ministry in charge of child protection, can you tell us or share with us quickly the framework with regards to response and prevention of violence against children in Ghana?
Hello, Ramana.
Yeah, Miss Abner.
Then can I share my screen when I talk about the child protection system that we have in the country?
Yes, we will share the screen for you immediately. Or you can also share it yourself.
Yeah, give me a
Please
few
go ahead
minutes.
and share your screen.
I can't share my screen. Oh.
Just can you click on share?
Hello.
Yeah. Okay, I think
Okay, I'm coming. Give me. Hello.
hello. Yes, we are waiting. Don't worry.
Can you see?
Yeah, we can
Okay,
see
it's on.
it's on, but you're yet to open the slide.
The slide is open now.
No, we only see your desktop right now. We see your email.
Oh. Hello.
Hello.
Mama, can you see now? Can you see now?
Yeah, we can see, but we are not seeing the slides. We only see the interface of your desktop. So your file,
Oh.
your document interface. Actually.
You're supposed to show.
Maybe you just take a
Hello.
few minutes, take your time.
Okay. Okay, then let me just talk about it because
Okay,
I think
please go on then. We can
uh,
show
so
your
if I've forgotten the lady, if she can share it on her side for me. So
okay,
I
we will
first talk
try.
about the various.
Mm.
Okay. We talk about, let's say, the various child protection issues
Mhm.
we have in the country. The various child protection issues we have in the country are varied because of the situation we find ourselves. We have corporal punishment. We have teenage pregnancy. We have teenage pregnancy. We have child trafficking. We have child abuse, child neglect, child marriage, child labor, child online abuse is an emerging child protection issue in Ghana right now. And also we have the lack of access to justice because sometimes these children are abused. They don't even know where to go to seek redress or even where to go to seek medical examination. They go to the nearest, they confide in someone and someone just say, okay, just keep quiet and justice is not served to the child. And another child protection issue we have in the country is unnecessary institutionalization of children in our orphanages and our children's home. When a child, some people just go and take children who are vulnerable and put them in the institutions and say they are taking care of them and to use them for funds and also exploit them in other ways. So these are the various child protection issues we have in the country. So we decided in 2014-15 to strengthen our child protection system in Ghana, to make it more robust and also make it more prevent abuse from happening. In order to do these things, can you next slide please? So in order for us to have a very, very effective child protection system, we have three systems that we are writing, three components that we are doing to make it very robust. We have our laws and policies. And I say we are still in the process of amending our Child and Family Children's Act, Juvenile Justice Act, because we drafted and we launched our child and family welfare policies and our justice for children policy. We saw that in order for us to have a very robust system, these policies need to be there to protect the child. And also, we need to So in doing those policies, we realize that we need to amend our laws, our current laws, so that it will be in tandem with our policies, so it go hand in hand. While students are being protected through policy, they're also being protected through laws. And also the child and family welfare justice system, we also needed to make it strong. And societal behavioral change is one very, very important component in our child protection system, because we know that in Ghana, children are seen and not heard. Most children do not even have the right to even speak up when things go wrong in terms of their rights. Also, even when they are even abused or violated, they cannot say that, and they keep it with them. And when by the time their parents realize, it is out of hand. So children are not seen as right. Most of the time when we go for our sensitization programs and we talk about child rights, children need to have rights. This is what a child needs to do. This is what the parents need to do. This is how to treat our children. Most of our community members and others will say we are spoiling our children, we are making them rude, we are making them become composed and other things. So these are the behavioral change that we as a country saw. It's very, very important to drive this change. So we came up with a Ghanaian Against Child Abuse campaign that we've launched, and this is going very, very well for us. And we also have the Community Child Protection Toolkit, where the child protection, they have different models of protecting children in terms of teenage pregnancy, in terms of corporal punishment, in terms of their health, how to keep their bodies with pictorial evidence. They are different forms that our stakeholders go into these communities and use it as a way of teaching and sensitizing the community members on the need to have a different mindset about the rights that concerns children. So in order for us to have this, we had the various, and we also realized that in our child protection system should be made up of child and family welfare and also the child justice. Because most of the time, this, because as I said, that our laws and our policies seek to promote the child justice also. We are amending our policies, our children's rights and juvenile justice for children laws. So this law, in the past, our Juvenile Justice Act didn't take care of children who were victims and children who were witnesses to crime. But the new law that is coming up will take care of all these things. And sometimes these children, they go to open courts and there are no protection for them. They have to face these abusers themselves. So for our child protection system, we put that we saw that a child, you cannot take a child out of the family. You cannot say the child is within the community, and everyone needs to be on board in protecting children, because child protection is a multi-sectoral thing. We need social welfare, we need healthcare, we need local authorities, we need community leaders, and we need police, we need the community development, NGOs, judiciary. So we found out that these are all the things that need to be put, support system that needs, the child needs to be protected from abuse. And also one very good thing about system is we are using both informal and formal system, because a child in the community is governed by traditional leaders, opinion leaders, assembly members, and all those people. So in order not to also overburden our system, they can take care of the non-criminal cases that affect children, especially like child maintenance, truancy, and other vices that the children face. So these are the things that come together. And we've got a lot of laws that protect and policies that protect children. As I said, justice for children. We have our social protection policy, where one of the very, very important social protection program that we have is the LEAP, which is the Livelihood Against Poverty program. And this also goes a very long way to protect our children, where cash grants are given to children, most vulnerable children. And as a child, if you benefit from this LEAP cash transfer, you are supposed to go, you automatically have to go to school. You are given a national health insurance card so that you can easily seek access to jobs, you can seek health care. And also you do not need to engage in any form of child labor or any form of truancy whilst you are under this grant. So we have our various community structures. As I said, a child is in the community. So we start from the Community Child Protection Committee, where issues are discussed. When it is above them, then they send it to the Child Protection Committee. That one is also there. Then we have the Regional Child Protection Committee and the National Child Protection Committee. The danger here is that we do not have a lot of our district child protection committees in place because of a few challenges. One also is the inability of the Department of Children to be in the district to also take care of these things. So we have our various policies. As I've forgotten any Bashira, or I've forgotten the one who spoke about child labor. We have a
Is it the
we
one?
have a child labor monitoring system where it takes care of. It's a system that monitors children who are involved in child labor. And when they find out a child is involved in child labor, then they find out what is causing this child to be engaging in child labor. Then they make sure that they give it, if it is employment that the mother needs to have, maybe they provide the skills training to the mother. If it is school that the child just doesn't want to go to school, then they link those kind of services to these children. We have a Ghana school feeding program. We have a free senior high school program, which is very, very, most of the time when children finish GSS and they are moving towards SS, there was a cutoff point. So these children are not able to go forward to the SS level, which is a very, very pre-tertiary. So then they drop out. And this also goes along with to affect our protection system. They go, so free SHS provides children to go to school free of charge. So even when your parents don't have money, you will be able to go to school rather than engaging in other forms of labor. So these are the various institutions that are part of protecting our children in the country. Can we move on to the next slide? These are all the institutions. We have STRAD, we have other things. And also, as I said earlier, you asked, how do we prevent and address child abuse or even protect our children from it?
Yes. What is so currently dealing with the pandemic and the increases in cases? What are the immediate measures that you've put in place to deal with the rise?
Okay. Currently, what we realize is our traditional and our religious leaders are very, very influential in our community. So in order for parents to know the benefit of protecting their children in these COVID times, and also at this time, children are vulnerable, and also follow the laid down protocol so that their children won't get infected with the COVID-19. We use our traditional and religious leaders in the campaign. We did a child protection and COVID-19 campaign where we engaged about 38 traditional and religious leaders in the country. We recorded messages, we played these messages on national television, we used community radio. They went to radio stations to talk about the importance of child protection and COVID-19, keeping your children safe from abuse, from other forms of abuse, and also protecting your children from contracting COVID-19, because realize that since the children were in the house, they were roaming around, going about. Some of the children don't go out and they don't even have face masks on in order to protect themselves. These traditional leaders did the campaign. We did.
Okay, I'm not cutting short.
Hello.
For
Yes, the time.
So these are preventive measures, but what are you doing to deal with cases that comes, like children that are being abused, victims, survivors? What are the measures being taken?
Okay, for start, we have a intersectoral standard operating procedure where when cases come, these children are linked to the various service providers to help them solve it. If it comes to the next, where you have this standard operating procedure, have various pathways for various topics. We have teenage program, we have SGV, we have child trafficking, we have child maintenance, we have a lot of. So when the cases come like that, then the entry point person looks at the case and to find out where to seek redress. If it has to do medical examination, which is a very, very, very thorny issue in Ghana right now, who to fund the medical examination of abuse victims. So, and also when these cases come, we try to make sure that the child get the necessary support in order for the child to be safe. If the child needs healthcare, we link a medical officer or somebody who is child friendly to this to the child for the child to get the medical attention. And also the police officers also try to arrest the perpetrators. They arrest the perpetrators and also make sure that the justice is done to the child. And also we also have the integrated social services. Child protection is not only about reacting, it's also about preventing. So what does the child need to be protected? And these integrated social services help the child so that when maybe help goes on their community sensitization or community outreach programs, they go with this essential officer, the social welfare officer, the national health insurance officer, the NIP coordinator. All these people go with them so that they know if a child comes and has a peculiar case, what are the services that they can immediately give to this child so the child will be safe. This project is being piloted in 60 districts in the country. And also one major issue within this COVID time is children online. I wouldn't say most of the children, but some children have their classes online. And we know children curiosity. They go to online, they are learning, because they have access to internet, they venture up to certain sites and they fall prey to child pornography, they fall prey to bullying and other forms. So this is also, we have a child-friendly course and also have a child protection forensic lab at the CID office, the CID headquarters in Ghana, which when a case is reported to them, they take it up on net and also make sure that in case there's a video of a child pornography, they find ways of taking this video from the system. And also they have a child online one-stop center at DOFSU. We are talking about one-stop shop for children. It's being piloted at the DOFSU. That DOFSU is the Domestic Victim Support Unit of the Ghana Police Service. We have that being piloted there. So child, and also as I said, the social behavioral change campaign, which is the GACA, is doing a lot of work on the ground in sensitizing children. Sometimes even children are being abused and they don't even know that they are being abused. So these people go on the ground, go to community, use other stakeholders to sensitize these children and community members on the need to protect children also of COVID-19. And as doctor said that they have included child protection in the training of medical students. We also have a child protection curriculum for people who are being trained as police officers in the police training academy. There is also a child protection standard operating procedure for health workers. And all these things come so that when maybe a child goes to the police hospital or goes to the police station, the police officer there should be able to know how to handle cases. Sometimes these police officers are not sensitive to these children and they brand them as bad child. What do you do especially when a child is raped or defiled? They brand these children as bad children. What did you go and do in this person's room? Why did you go? So when they are trained, then they will be sensitive to the need to protect the child's innocence or to protect the child from these abuse perpetrators. So these are all the things we have. We also, in order for child protection issues to be very, very well catered for, child protection, the district chief executive officers in our various districts, they need to tackle child protection issues in their various districts. And this is put into their performance agreements. They need to report on what they have done in protecting children in their districts. Because if you do not do all these things, it will go against your performance, your appraisal. So these are the various things that Ghana is doing to protect children, especially in this time.
Thank you so much for sharing all this with us. Just a quick question on the one-stop center at Dovsu. Can you share when did it start and how has it been running so far? Just a quick one.
I do not know much about. I know it started last year. Last year, I think they were celebrating 20 years of the existence of Dove Soup, and UNICEF supported them with this project. So in this project, where a child goes there, all the various activities that Zanzibar talked about are there. And I also have to say that in the Tamale Teaching Hospital, we have as I said, we have our regional child protection committees in place. And that committee in the Northern region is together with partners are establishing the one-stop center for children, for abused children at the Tamale Teaching Hospital. And when a child goes, all these services will be provided for them. And also, I know in the Ashanti region, a doctor, as I said, medical examination fees is a major hurdle in children seeking justice for them. So the Ashanti Regional Child Protection Committee have also identified a medical officer who has agreed to do this medical examination for children free of charge. So that the children, it will be
Okay,
so
thank
that
you.
the children,
So
thank you very much.
can we then say that because we did the technical training for the establishment of the one-stop centers in Ghana 2 years ago, and if following that, because it involved DOVSU and all those key stakeholders in the child protection system in Ghana. So if this has been started in DOVSU, I think it's wonderful, and we at World Future Council are proud to say that we started this processes and it's now being established, and we are very grateful, and we will be happy that you include us in some of these things when it starts. Or
Hello,
you
Raman, are you? I don't know whether you have a branch in Ghana, so that maybe we could get you.
well, we don't we work across the world, but we have our offices here in Germany. But we work hand in hand with Ghana. We've been in Ghana 2 times. We've done the technical training, 3 days training for how to establish and run and manage. We brought experts from Zanzibar, experts from Canada, and so yes, we've been working hand in hand, and we are very happy that at least Ghana is taking the initiative. We are also in the process of helping to start a full-blown center in Kolebu, working with Professor Badu and his team, and working with you, the Department of Children, and yeah. So we are happy that things are moving, even though it's a bit slow, but at least we are on the right path. So, and I will be coming to Ghana very soon, in 2 or 3 months, so that we'll continue with the discussions, Abner. So thank you so much, Miss Apreku Bedu Abuaje. And well, we've all been told, or we've been educated, we've been educated in one way or the other about the issues happening from the world view or the African perspective by Dr. Nkata, and then we have the insights from the rapid assessment done by Ms. Bashira Tukamal, and we've heard from Ms. Halima how their project is going, and how we can also pick 1 or 2 lessons from it and help to build our own in our various countries and communities. And Miss Halima, they are there. We have a detailed report on their process on our website. So if you want to learn how they did it, we have reports on the establishment of the One-Stop Center on our website. So you can go there and download the reports, and then if you need to know more about how the process works. So we all have a duty now to create awareness and report cases of abuse against children to the authorities, to institutions assigned to deal with it. If you don't know how to contact the institutions, there is always somebody who will help deal with some of these cases, or who will help to direct you to the right institutions. Please don't look away when you see an abuse. We all have a duty to protect our children. They are the future. Please choose to challenge, as the theme for this month's celebration of women, Women's Month is choose to challenge. Choose to challenge issues of abuse. Choose to be there for children who have been abused, and be their voice, and be their help. So thank you so much to our esteemed panelists for the insightful discussions, and to our participants for joining and for listening. I will now go on to read some of the questions. And if you have any question, if you are listening and you have any question, please write, and our panelists will be here to respond. If it's, you can direct to a particular speaker. Otherwise, any of the speakers are invited to answer the questions. So I'll go quickly into the questions I have here. Miss Halima would like to say something quickly before we go into the questions. So Miss Halima, please, the floor is yours. We can't hear you.
Now you can hear me?
Yes.
Okay. First, I didn't want to say anything, but there were some few points I wanted to say
Okay.
with regard to the success of One Stop Center. No, it really depends on the political will, political will and the commitment of the government. You know, when there is a high political will, it helps to support this center. But when there is not enough political will, so these centers they really don't work effectively. Because we see on our side, when we see the president or even the members of the House of the Representatives, they mostly visit the center, and also they see the challenges and try to strengthen the center, so at least it supports the centers in one way or another. But other things, other the success of WhatsApp Center, we have started to put the suggestion boxes for the people to give us some suggestions on the working of the WhatsApp centers, and we see that most of them they really appreciate the effort of the government for starting such centers. And as I said earlier, that most of them they wanted it to start in their own districts or in their own shahirs and so forth. But those suggestion boxes also help us to improve our services. Like most of them, they said also they want the centers to work for 24 hours. In fact, it was a challenge for us because we did not have enough staff, especially in the medical field. So we started with maybe 12 hours, for 12 hours or 16 hours, something like that. But 24 hours, we have only one center which is working for 24 hours. So it helps us to improve the service. But also with the availability of or making the available free medical supplies and equipment for these centers, it has helped a lot, so that the people were not feeling they always were willing to come to the center. This is what I wanted to say.
Okay, thank you so much, Ms. Halima. Points well noted. So we go quickly to some of the questions. So a quick question from, I think it's rather a comment from Comfort Ali. She says she runs the Street Childcare and Welfare Initiative. I think so, in quotes from what she wrote, I think one of the issues that I see a lot of the time is that when we are making decisions regarding children, we do not involve the children. That's where we do not really know their pain areas, but mostly work on assumptions. Most of the time we discuss how we are doing things in the best interest of a child, but how can we justify that without including them? That is a very, very good point. If you are within the child protection sector, one of the things that are being hammered on now is child participation, which is also captured in the Convention of the Rights of the Child, the UN Convention on the Rights of the Child. So I won't go deep into it because for lack of time. Another question here is, my name is Alvin Vimford. I work for the African Network for Prevention and Protection Against Child Abuse and Neglect in Liberia. Thank you for joining us, Vimford. There are many cases of violence against children as a result of COVID due to the closure of schools, as children now spend more time in home and the neighborhood. What can be done to strengthen protection of children in home and neighborhood? What are other alternatives in providing some education for children in home and community while schools remain closed? That is for Professor Badu or for Halima, or also maybe for Miss Dr. Nkata. So if any of you want to pick this, maybe Dr. Nkata.
Thank you. I'll try. I don't know if I should only answer that because I see there's also a specific question directed to me.
Okay, then pick the two. Then please.
Yeah, I'll just try and respond to the two of them. So as far as what can you do to protect children in the private space, I think one of the main things that has, like I said at the beginning, is that now we have disrupted child protection systems during the COVID crisis, in the sense that child protection systems rely on certain institutions being available for children to access them. I think what can be done in retrospect, and as I said, even if children themselves were not consulted, but besides children not having been consulted, I think one of the unfortunate outcomes of the approach, of the very drastic approach to dealing with COVID, is that even the children's sector, people who work with children, were not consulted. So one of the starting points is to actually even speak to people who work with the children's sector and prioritize those as essential workers. Because one of the things that has happened is that there has been a difference between who is considered an essential worker and who is not, and based on that, how they continue to be able to access their clients. So services related to children's care, such as community social workers, volunteer children officers in the communities, could be facilitated, particularly in Africa, where we rely to a very large extent on volunteer community child welfare officers. Those kind of people needed to be facilitated, and their role needs to be recognized as part of the essential services. That is one way of making sure that at at the local level, child protection doesn't get lost in the process of dealing with a pandemic. In communities that are very extremely marginalized, like in the rural areas, those functions are very critical. So we also have community policing. We have really local level kind of administrative structures. To have a child focus in those administrative institutions would solve a lot of the problems that we have in terms of accessing formal mechanisms where children actually are not able to access formal mechanisms. When I spoke, I didn't have the opportunity to go into what is being done. And I think maybe it would have answered some of those issues, because what is being done, there is the point where we try to address child abuse of children or violence against children through law. We are still asking and seeking that countries, adopt the necessary laws and policies to give effect, so that we have a basis for going to enforcement structures. But that's only one side of the affair. One of the other things that we have to agree as a continent, for instance, as a region, is even as basic as how do we define violence against children. We don't have consensus over how we define violence against children. And that is why some of those things like emotional abuse, psychological abuse, is not recognized in law. It's not just a question of recognizing it. This is a problem that applies to children, but it also applies even in the context of women's rights. So we know that, by law, international frameworks say psychological violence is a form of violence. But how do you prove psychological violence in a court? A law has to be structured in such a way that evidence does not have to be physical evidence. So one of the things that we need to do is we need to relook or audit how laws are structured across the continent and to see whether that captures, one, a consistent narrative of what violence against children is. That would also make it easier for us to be able to compare from country to country and to share work in progress. The second thing is predominantly responses that are being had on the continent to violence against children are driven by charitable NGOs. And governments have, some of these processes can only be effective if the government actually owns the initiative for addressing violence against children. The disproportionate representation of NGOs in services relating to violence against children is a reflection of lack of prioritization on our government side. So I think that is one of the advocacy areas. Governments are working, some governments better than others, but I think we need to be able to encourage governments to take more responsibility and to mainstream it to the lowest levels of administration. And countries that have done well, like Zanzibar, for instance, would be in a position to share that experience with other countries on how do you take it up, how do you make it work on a day-to-day basis. But the initiatives that are working, like if you look up the Africa, it's called the Aprivac, African Platform on Elimination of Violence Against Children. That's an initiative that combines both government, non-governmental organizations, NGOs, trying to sort of work with the systems, pilot in some countries, some methods or processes in which you can address violence against children. So there are initiatives. They just may not have fully materialized, but there are some here and there that can be reproduced. The model, the one-stop model of dealing or responding to violence against children is also being attempted in other countries. Maybe we don't have the time to get into the details of it, but I think that is an initiative that we really need in other countries, even the ones that have better facilities. Even in South Africa, we have, it's there. But you know, some of these other African countries, you find a police station in one place, the next available hospital that has the capacity to do assessments is too far away. So these models is the only way actually of ensuring a child-friendly response to violence against children. So yeah, I would think we are making some progress, just maybe not there yet, but it can be worked.
Exactly. Yeah, I think also we are making progress. Just that COVID is trying to derail some of the progress we've made so far. But yes, if we start creating the awareness, if we start talking and taking action, then we would accelerate the progress and then move further up. I will read some few comments here from our audience. We have Claudie Janizi, if I'm right with the name. It said, when children are not allowed to leave home, like during the pandemic, they need to find opportunities to report sexual abuse as they are not seen by professionals. Yes, you're right there. Then Makoni and the same Janizi, policy consultant. Okay. We have a comment from Abubakar Suleiman from UK. Says very informative session. It's great to have an insight on what's happening in Ghana, quite different from the experience in UK. I think I know this this participant. Thank you very much, Alaji Garba from the UK. In Ghana, there is the need for education and awareness session in all our local communities to the dangers of sexual exploitation, child protection, and violence against children, which is very, very true. And then the last comment was, what can be done from your point of view to capture violations against children in law? Okay, I think from Laura Marie Esterman, she's asking what can be done in your point of view to capture violation against children in law. So quickly, I will give this to maybe Bashira. If Bashira can, and then Dr. Nkata, because you deal so much with the law, maybe quickly.
Okay, Ramana.
Mm.
Yes. So the person, if I got the question right, is asking what can be done concerning capturing violations in the law, right?
Law, yeah.
Yes. So I think one of the first things we need to do is that the law does not work solely. It works with other systems, including institutions, that needs commitment and resource allocation. But if we missed on some part of it, we might have a law that does not adequately respond to the issues we are trying to even address in the first place. In terms of law, in Ghana, I think Abina also mentioned in her presentation, the Criminal Offences Act and the Amendment Act say so much about some of these violations. The Children's Act is also very clear. What is missing is the gap between implementation and knowledge of the existence of such laws. And also the fact that we need to harmonize some of these laws. So you find discrepancies in some of the law. And one of the major issues that we've even encountered in Ghana has to do with what people call the discrepancy between the age of consent to marriage and the age of consent to sex and the age of marriage, which is 18, and the age of consent to sex is 16. So you find a lot of parents arguing that on that score, it means that if my daughter can consent to sex at 16, why can't she get married at 16? So some of these discrepancies goes a long way to derail the work that has been done so many decades away, because people just don't want to understand why one part to commit blunder. So I think that beyond having laws and policies and legislations, we should also look at one commitment, sensitization, because for me as a person, because I know that some of these things exist in our legislation, I'm able to use it. But for someone who does not even know that there exists a law like that, it becomes so difficult for the person to even seek justice. And we need to let people know and understand the processes of seeking redress, and the system should be in place to support when people decide to seek redress. Like for instance, in the law now, once a person is defiled or raped, you need to get a medical examination done. That is also coming with the whole cost, which is the medical fee, which activists have been trying so hard to get government to take it off the victims. You go to the hospital and they are charging a medical fee of about 300 Ghana cedis, which is almost close to $50. And this is coming from a family that cannot even afford a square meal in a day. So people end up living along the way. So it's important that we harmonize laws and we have laws that reflect the needs of people. In the presentation by Doctor, when she started, she did say something that, are we consulting the children? We are making laws for children. The children do not even know about the existence of those laws, but those laws are there to guide them and to protect them. So knowing these laws is also a step ahead in terms of protecting the children and making sure that the system works to their benefit. Thank you.
Thank you very, very, very much. So quickly, maybe Doctor would want to say something, and maybe Halima also will say something quickly. So
well, I had begun to mention some of it in my previous comment in as far as how do you capture those things in law. And I think one of the ways that has just been mentioned now by the previous speaker is that laws don't operate in vacuum. Laws operate within a society. And so one of the tragedies of lawmaking on the African continent is that generally we have tended to import without questioning laws from other jurisdictions, or even when we share laws from, like I've been involved in law reform processes where people literally pick the law of another country and try to transpose it into their country. That one of the problems of that, there is nothing wrong with harmonization, but we need to learn how to actually domesticate our laws in the sense that you have to contextualize it to how your society actually functions. So you find that in some countries, depending on how society is organized, it might be easier for children to go straight to the police because maybe the police function in a particular way. In countries that have, say, like some countries have very well established administrative units that might be semi-formal. They are recognized by the formal system. They are not necessarily part of the main government, but they play a huge role in organizing society. You cannot in that society then come and just import a law because it works in other countries that says that children's violations should be reported to the police. If the local practice is that children go to the assistant elder or whatever. So one of the main issues is that we don't have our laws localized enough for them to capture our particular context. And that becomes a difficulty even when, if you try to prove a crime in a court of law, in a formal court of law, yes, there's what is written in the law. But remember, people must always express themselves in their local language, in their mother tongue, to be able to give evidence. Some of these concepts need to be translated enough that a child who appears before a system can speak in their language and people can still understand what the violation is. So what my personal thinking, reflection on it is, one of the main things that we need in Africa is that we really need to own our laws and make them local enough that those laws can make sense to the people that are using them. Secondly, the way the laws are structured, like I started by saying, some things is a question of harmonization, but very purposefully. You have to think through, when you think about changing the Children's Act, you must think through how changing the Children's Act interacts with the Evidence Act of that country. Otherwise, and the Criminal Procedure Code of that country, it doesn't work to just change children's law, which is the approach that has been taken generally within the children's sector, is that we agitate for adoption of a Children's Act, a comprehensive Children's Act. It doesn't work if the harmonization is not across the board. And thirdly, just as a final, we know we have the African Committee of Experts on the Rights and Welfare of the Child at the AU level. And the African Committee provides standards, guiding standards that are supposed to help us to standardize the interpretation and the implementation of norms and standards across the region. So of course, the committee has already set out some of these standards as far as violence against children is concerned. So to me, countries that have not yet, given effect to that, what the committee has guided, are already, making life hard for everyone else. I think that harmonization is important from border to border. As you would know, within the African region, particularly within the sub-regions, we have too much movement, freedom of movement. So if a child who is Nigerian finds themselves in the neighborhood in Niger or somewhere else, and they want to still be able to claim, against violation, the standards should be the same. So children have a common understanding of what those issues are. Same thing in the East Africa community, in SADC and all that. So if that is the case, the only way for us to do that, to harmonize at that regional level, is to accept the standard that is being offered, or the interpretation that is being guided by the African Committee of Experts. So I would really also urge us to go back to that common understanding and then legislate on a harmonized and coordinated manner to address violence against children. Ramana, you are muted.
Sorry. Yes. Thank you so much. Standardizing, harmonizing our laws across the continent is the key point here. Thank you so much. So I invite Halima for her quick response too.
Okay, thank you. I'll be very quick, Ramada. I know the time is really. In fact, I'm really glad that I attended this session, and I thank you so much for this very interesting and informative session. But seeing the comments and also the comments which the viewers are giving, and also the comments of the participants, and I see that now it's important for us, I think, to think that we have to do some kind of research to see the impact of COVID for our children, especially for our children during the COVID times. Because here I was discussing with my colleague that they have received many cases that many girls, they did not return back to school after the closure of they did not return back to school. Most of them were married, and most of them were even abused during the COVID time because they were at home. So I think it's time for us to think that maybe do some research so that we can come out with some plans and programs which can combat this, this situation. Thank you. Thank you.
Thank you so much, Halima. Thank you. The last question we have here, we don't have much time, so we're just going to go quickly on this. Is there a plan for interventions by the World Future Council to improve child protection systems in Africa countries through partnership with national organizations? I will quickly answer you, yes. That's what we are doing. That's why we organized 3 years ago a huge conference in Tanzania where we brought so many African countries to come and learn from what Tanzania is doing, because we have like the same social setup, similar cultural setups, similar challenges and opportunities. So we brought a lot of countries from Africa, those stakeholders who were in child protection sector to Tanzania. And then we followed up with those who expressed interest in starting the process. So like Ghana, we followed up with Ghana. We came on scoping mission in Ghana. We came to organize a 3-day technical training for child protection stakeholders in Ghana. And as part of it, that you just heard from Abina, that DOFSU, with the help from UNICEF, has started a one-stop center at the headquarters, at the police headquarters, which we are very, very much happy about. And we will continue to support any country that is interested in going through the process of establishing a one-stop center. We advise countries to own the process. We will come in to give you the support, the technical trainings and all that, but you have to own the process. You have to do it yourself. We only come in to support you. So any institution or any country that is interested in setting up a one-stop center, you are free to contact us. You go to our website, we have our contact there. You contact us and we will be happy to partner with you to see the process done. So all too soon, we said we were going to do 1.5 hours. We've gone overboard, but it's okay because this has been a very interesting discussions and a very educative session. So thank you for being with us on this Zoom session, and those who joined also from Facebook. I would like to now end this session with a huge gratitude to our esteemed panelist, Dr. Nkata Murungi. Thank you for joining us, for sharing your knowledge with us. Dr. Ebenezer Badu from the Kolibu Teaching Hospital, thank you so much for your time. Ms. Bashira Kamal, thank you so much for sharing your results of your the results of your rapid assessment with us. Ms. Halima Salum, thank you. Ms. Mukasi Abdallah, thank you so much for sharing your experience and expertise in implementing a one-stop center from Tanzania. And finally, Ms. Abena Apraku Bedu Abwaji, thank you for enlightening us on what Ghana is doing. And thank you all for accepting to share your time and knowledge with us. We are extremely grateful. To you all, our cherished participants, our audience, both here on the Zoom session and those from social media handles, from Facebook, thank you for listening. Thank you for your time. Thank you for joining us. We hope that all of you will be ambassadors of child protection in your various communities and help protect children, because children are our future. We need to protect our future. So please, individually, there is so much you can do. So be an ambassador of child protection in your community. When you see an abuse, don't look away, please. Choose to challenge, choose to report, choose to support victims of abuse. And I would like to thank the entire team at the World Future Council who have been working tirelessly behind the scene to make this program a success. Samia Cassett, Miriam Peterson, Anna Lara, Annika Weiss, and our Executive Director, Alexandra Vandal, and all the staff of the World Future Council who have contributed to making this a success. Thank you all so much for your efforts and for your dedication. Please follow the World Future Council social media handles, Facebook, Twitter, LinkedIn. You will have all the information you need to know all our programs. We have subsequent themes and topics in our Forward Thinkers webinar. The next topic we are going to handle, I think, is on forest. So please follow us on our social media handles, and then you'll be notified when we have the next educational, insightful session for you. Thank you all once again for joining us. See you another time. Have the best of the day. So from all of us here, thank you.